Aloha, welcome back to the Anxiety Coaches Podcast. I'm your host and coach, Gina Ryan, and I'm so happy to be with you again today as we consider the many ways to bring your mind and body back to its natural peace and calm. Welcome, everybody, to the Anxiety Coaches Podcast. I have a very special guest for you today. And so I want to tell you about Dr. Fred Moss, who is joining us. He's a pioneering psychiatrist, which I know you are all going to find fascinating. He's the author and mental health advocate with over 40 years of experience. He's the founder of the Welcome to Humanity movement and creator of the True Voice course. Dr. Fred is passionate about helping people align with their most authentic selves. He's got a career that includes working with over 40,000 patients, keynote speaking, coaching, and authoring transformative books like Creative 8 and Find Your True Voice. Dr. Fred's mission is clear. It's to inspire connection and healing through authentic communication. Welcome to the show, Dr. Fred.
Thank you so much. It's great to be here, and thanks for that warm words of an introduction. Truly appreciate you.
Well, it's so nice to be with you because here at the Anxiety Coaches Podcast, we're always looking for other ways besides the traditional medical model to work with things such as our emotions and our feelings, and they often get pigeonholed into diseases or ailments. And what struck me about you was hearing that you are considered, is it like the Undoctor? You want to tell us a little bit about that?
Yeah, sure. So thank you so much for that. So yeah, the Undoctor is a, affectionate moniker that I picked up from a friend that I was on a retreat with as I was, talking a bit about my approach to assisting others with mental health. And basically, in 2006, and I could go through the whole story, but we'll talk a little bit about what happened in 2006. I finally got tired of doing things that were not aligned with my values. And, I came out of medical school with the idea of bringing communication and connection into psychiatry as an industry. I had already known quite a bit about psychiatry as I had worked as a childcare worker for 9 years and really despised psychiatry, the direction it was going. So there I was bringing communication and connection into a field that really wasn't welcoming that from the psychiatric vantage point. So instead, what they were hoping that I would become, or how I was typecast, was to be a diagnostician and a psychopharmacologist primarily. And these days, if you ask somebody what's the difference between a psychiatrist and you name it, that's what they'll say, that a psychiatrist is the one that prescribes medicine. And it was really misaligned with who I knew myself to be. As a childcare worker, I knew that if I communicated with these children, who was only like 6 or 7 years younger than me, that I could make things happen, that healing and cure would actually happen inside of warm, harmonic, high frequency communication, usually through powerful conversation. And I knew that and knew that that was the essence of where healing actually took place. So going back to the story, in 2006, I finally got tired of being, a primarily diagnosing, medicating physician, and decided that I would do something that I thought, wasn't fairly high risk. I now had learned so much about how people really respond to medicine. And I decided to take a big chunk of my patient load off of medicine that year and watch what happened and be with them and support them. And sure enough, they got better, like reliably and predictably better, almost all of them. And, the idea was that, that these medicines were actually causing, or at the very least, inducing, increasing, or perpetuating the symptoms they were marketed to treat. Like, that's what I knew now. I actually knew that. I had actually done the experiment that was required in order to learn that. And now I knew that. So because I knew that, I was kind of furious. I even was interested in being violent, not like I'm going to hurt somebody, but, screaming it from the mountaintops, calling my friends, calling the parents of the kids I was treating, calling, people who were worried about their parents, their own parents, et cetera, and letting them know that this line of thinking wasn't working. I soon learned that being violent and screaming about it wasn't really a way to get the message across. And so I needed to find a way to soothe myself and start figuring out, well, where is it that I can make a difference? How can I actually make a difference with this knowledge that I know that flies against the actual standard of care inside of the industry. So I did a lot of traveling. I started traveling around the country. I was a traveling doctor for about 8 or 10 years and was in many different states in the country, seeing how psychiatry was delivered. By the way, not so different from state to state, for sure. But it is different when you leave the country. And so I had the audacity to go to many different countries and be a psychiatrist, including Bhutan and Thailand and Nepal and also Israel and France and England and Italy, where I had multiple conversations with clinicians and with patients or receivers, like, providers and clients and customers, whatever you want to call them, and really began to look at what is it that people want and what are they getting? Where does healing actually take place? It became very clear again, like amplified and emphasized, that healing takes place inside of a human connection. And everybody is seeking a human connection, no matter where I went. Like, it didn't matter if I was in Nepal or Kathmandu or if I was in St. Louis, it was all the same. People wanted a connection. So I knew I was on the right line. And I also started to look at, well, how can I make a difference in this? Where's the soft point? Where's the entry point to this vicious cycle? And the entry point, believe it or not, lands in all of us. So it is the idea that if you think there's something wrong with you, when you come to a psychiatrist, then you will get confirmation of that from the psychiatrist and then get the treatment and the medications that are designed to deal with that particular concern. But in fact, because they actually cause that concern, the horse and the cart actually shift. And now the medications are actually giving you the symptoms that you thought you had in the first place. And since that's the case, you don't know it. You actually think that you're getting better because of the medicine on those few moments that you're better, and getting worse because of your condition on those few moments that you're worse. And in fact, it's actually the opposite way. So when I got that to learn, I was like, okay, the way to go after this is to remind people that there's nothing wrong with them. See, people don't come to a psychiatrist to find out if there's something wrong with them. By the time they show up at a psychiatrist, it is because they already know in their heart of hearts that there is something wrong with them. And that's a normal human condition, by the way. We all know there's something wrong with us. And so it's actually a sign of being normal to know that there's something wrong with you. It's like a universal truth. So, instead of like realizing how was I going to get people to actually see that there is a way to do this without walking into the conventional system, landing a diagnosis, landing a treatment plan and a therapist, landing a clinician, and then landing some medications which actually create the chemical imbalance that you thought you had in the first place. Like, how am I going to get that done? Where is the entry point? And that, now you're speaking to how the Undoctor got its birth, because ultimately the only way to get that done is to have people see that you're not broken, that handling the experiences in life, including anxiety, including depression, including being like terrified, including feeling awkward, including not meeting your deadlines, including being mean to your friends, including drinking too much, including smoking too much weed, including like taking drugs. If you can get that none of that means that there's something wrong with you, then there's a possibility of not knocking on the door of the conventional medical system. And I know that I'm going to make you worse. I took an oath. My oath says, first do no harm. In that first do no harm oath, I wasn't sure that I wasn't doing harm. In fact, I'm a little bit sure that when I do actually give someone a diagnosis, that's already massive trauma. And after the diagnosis, when I'm given medication, I just expand that trauma. Now, that isn't true with everybody. So let's give an important disclaimer here. There is a great number of people who are very, very, very happy with this treatment that they're getting, the therapists that they have, the medications that they're getting, the therapy that they're getting, et cetera. And those people don't want to change what they're doing. And, as far as I'm concerned, if you reach a point in your life where you're at the end of that particular line and you wouldn't trade what you have going for anything that might be way better, or not, like you're stuck, like this is it, this is what works for me, I already know, then by all means, please keep doing that. Of course. If you reach that way anywhere in life, good for you. I wish I would reach that way somewhere in life, but some people actually reach that place. I guess. That's really fantastic. Like, please don't change your medicine. Please don't think that I'm asking you to change your medicine. If you're very happy with any part of your life, keep doing what you're doing. That's the goal of being here, is to be really happy with your life. This conversation is geared towards the tens, if not hundreds of millions of people who do not believe that, who believe that they're misdiagnosed, underdiagnosed, overdiagnosed, mistreated, undertreated, overtreated, whatever their belief. And this group actually knows in their heart of hearts that what I'm saying finally makes sense. Now, this is really important to get. If you can get that having the pain, having the suffering, having the misery goes along with being human, as does the miracles, the ecstasy, the love, the comfort, like all of those things are different flavors of what it means to be human. And if we can embrace the unembraceable, if we can embrace the unpleasant experiences that are part of being human, as for being human, then we don't have to show up on a doctor's office declaring out loud that there's something wrong with us. Psychiatry is the only subspecialty that I'm aware of that if I tell the patient that they're okay, they get pissed. What is that? That's just wild.
It's crazy.
That's just wild. What, like, they're like, no, if I was okay, I wouldn't be here to see you. It's like, no, seriously, you're okay. No, I'm not. I'm going to go next door and get a doctor who knows that I'm not okay so that they can give me some form of so-called anti-anxiety medicine, which causes anxiety, or so-called antidepressant medicine, which causes depression, or so-called antipsychotic medicine, which causes psychosis. And that's what I'm going to do. Now, they don't know that it's actually causing those things because, if you knew that it was actually causing the symptoms, you probably wouldn't take it. But that's a well-hidden, it's not even a secret. It's almost like an illusion, like one of those snow globes,
Yes. Yeah.
Yeah. That's what.
Oh my goodness. You said that so well.
Thank you.
You're like speaking my heart here. That's why I was so taken by the work that you have done. So if that is the case, what do people since that is the case, and I totally agree with you because we hear the same thing over and over again. What do people do? Because this happens if they had been on the medications, they decide it isn't helping anymore is sometimes what comes up, or they're just saying it never really helped. I don't know why I've been doing this for years. Years. What is their next step to developing their own way of finding their way out of this medical, but personal, it's also personal conundrum?
Yeah, it's a great question. Super great. Thank you for asking. Okay, so we're going to look at two groups of people. We're going to look at the people who are already in the system. The people who are already in the system, already being medicated and now realizing that these medicines aren't helping, but they're super afraid to leave because they bought the rhetoric that if they leave, they're going to go through Ray Charles level of withdrawal, and they're going to, have a more difficult time actually coming off the medicine than if they were on it. And maybe their symptoms will come roaring back and they'll have a worsening sense of depression or anxiety or confusion or whatever. These people are very afraid to come off medicine and they really are like, how am I possibly going to do this? It's funny, they should have asked that question when they started the medicine, of course, rather than being so open and free to take whatever the chemical is that got designed in one of these high-rise office complexes. I don't have anything against the pharmacological industry. I really don't. I mean, in the same way, I don't have anything against the rat poison industry. It's all good, man. You just, you don't have to eat it. You don't have to. It's not their fault. They're created a business that is actually freaking rocking. I mean, congratulations. We're talking about billions of dollars a day in profit margin alone. Dude.
Yeah.
Nice work. Seriously, really effective business model. I don't have a problem with that. That's good for you. But if you really want to come off of medicine, we're looking at two people. We're looking at the group that are interested in at least the services I provide. For instance, the group that's thinking about coming into the industry and the group that's already in the industry. You're talking here about the group that's already in the industry and how can they possibly come off the medications, which not only aren't helping, but very likely, no kidding, are actually contributing to the ongoing symptoms that they thought that they had before they started them. They may have had a little bit of it before they started. They may even had whatever it is, but it is treating the symptoms. It's actually creating the symptoms it's marketed to treat. And when you really get that that's possible, just because you have a cut, if you put a Band-Aid on a cut that has a razor blade embedded in it, you can be sure that cut's going to get worse.
Yeah. Wow.
That's what this is.
Yes.
Okay.
Wow.
You still have a cut. It's true. You're like, I still have a cut. That's my original cut. I had it before I started medicine. I get it. Now it's gotten worse. Guess why it's gotten worse? Because it's gotten worse because you take medicine. That's why it's gotten worse. It's okay. Like, that's totally okay. And if you want to come off medicine, there's lots of books by a lot of my peers about how to come off medicine. Peter Bregan has written a bunch, and there's a bunch of people, Kelly Brogan's written a bunch. There's people who've written some cool books, and Kelly's my friend, XO is Peter. And we start, really looking at, well, how do you do that? Well, tapering is not necessarily the right answer. Let me say that.
Okay.
And why is that the case? Because tapering just prolongs what's happening with you. If you're on 100 milligrams of something, and now you're going to be on 50 for a few weeks, and then you're going to be on 25 for a few weeks, and then you're going to be 12.5 for a few weeks, and then you're going to be on 12.5 every other day for a few weeks, and then you're going to be off. Okay, I understand. Here's what happened. One day during that tapering, you back out of your driveway and you hit a fire hydrant. You're like, whoa, that never happened when I wasn't coming off of meds.
Yeah.
I'm going back on.
And there's a lot of time for that to happen.
A lot of time for that to happen. There's no real safety. The only real safety, ultimately, the only real place that's an important leap is a leap from some to none. That's it.
Okay. Interesting.
When you think about it, less isn't any closer to zero. Zero is zero.
Yeah.
If you have 2 strawberries, you're not closer to 0 strawberries than if you had 4.
Yeah.
You have 4 strawberries, you had strawberries. You have 2 strawberries, you had strawberries. You're not closer to 0 by having only 2 strawberries.
Right.
So we think, because we think in a number line, that decreasing our dose gets us closer, so the leap isn't so far from where we were when we finally come off. It is not clear that that's the case at all. And the whole idea of tapering, the whole class of psychiatric medicine, is kind of a viral expansion that, back in the day when I was going to medical school, there was only one class of medicine that you would even consider tapering, and that was the benzodiazepines, the anti-anxiety agents. All the others, you just stopped. You could stop on a dime. It wasn't a problem. Now everybody wants to taper everything. Now, what you really want to do is you want to give people an opportunity to see that there's nothing wrong with them, and that they might, in fact, upon discontinuing medicine, get a spike of the symptoms they're marketed to treat. Okay. They might get a spike of it, because that's also how the medicines are designed. Look, this is an extremely well-designed business model. Wow. It is fantastic. No one even knows it or takes responsibility for that fact. And there's not like there's someone running the show who's a nefarious fool.
Right.
Everyone's doing their job in their little section, and they're great people doing their job. Totally sure they're doing what matters to them, and that they're contributing to the grander scheme of things. But this, when you overlook it, go to 30,000 feet and looking at this is what's occurring. Wow. So, how do you come off medicine? Well, the first thing you better learn before you come off medicine is there's nothing wrong with you. Yeah. Because if you come off medicine and you're still sure that there's something wrong with you, then the only question you're going to ask is, how are you going to treat me now? How are you going to treat my illness now? Except maybe you don't have an illness. Now, what we can do, and that's what the Creative 8 was written for, the Creative 8, healing through creativity and self-expression, is we can give people outlets, like ways to actually, so much of mental health has to do with communication. Our inability to communicate effectively with the people in our inner circle or our friends and family, or perhaps our inability to communicate with the world at large, or to be able to either speak or listen to the world or our friends or our colleagues. Since it's almost always about self-expression one way or another, we can use art, music, dancing, singing, drama, cooking, writing, gardening. We can use some of the creative, visual, and performing arts. And when we do those things, we can see that the so-called symptoms or the discomfort actually dissolves while we're doing those things. So this is a capacity to give people access to the creative arts and have them realize that while you're communicating through those levels of, let's say, alternative self-expression methods, your symptomology or your discomfort actually disappears. And then when it disappears, you now have a choice whether to go back to your disempowering context or not. Yeah. It is not coming to get you. It's not waiting in the corner, like doing push-ups in the corner, ready to get you, like some actual, formats suggest. It's not that. You have a choice. Now, these medications are causing some of the chemical imbalances that you thought you had in the first place. How do I know that? Because that's what they do.
Mm.
How do I know that? Because that's what they do. We all know that.
Yeah.
We're hoping that it's counterbalancing to the so-called chemical balance that we had in the first place.
Right.
But it isn't. It's actually its own, because you didn't have a chemical imbalance even in the first place.
Right. Right.
So when we can get all this in education, we can start seeing that, oh, I'm going to have a spike of the symptoms when I discontinue the medicine. Yeah, you might. It's time limited, and we're going to keep working with you. You might not. It might go by smooth. Many people come off medicine, no problem at all. Some come off, they got a little spike, they got some issues. And some of these medicines are a little gluier than others. So the first step is, I can't emphasize enough, is the consideration that there may not be anything wrong with you and never was.
Yeah.
That anxiety, in this case, given the title of your podcast, that anxiety and depression, psychosis, discomfort, distraction, awkwardness, inability to complete tasks, inability to interact effectively, addictions, all those things, they are choices.
Mm.
And when we have that, you are a much incredible, resilient human being, like the most resilient creature in the history of the world is a human.
Mm.
And what we can really do with that, we can stand in ourselves as being whole and complete, even with misery as part of our subcomponents.
Yes.
It's like okay to be miserable.
Yes. Thank you. Yes. Okay, this is a good place to stop right now. We've covered so much ground today from Dr. Fred Moss. I hope you're feeling as inspired and informed as I am. But this is just the beginning. In part 2, we'll dive even deeper. Trust me, you won't want to miss it. If you've enjoyed this conversation so far, make sure to tune in to part 2, which will be dropping in a few days. I'll see you there. And now for today's quote. There really may be nothing wrong with you. No kidding. And that's from Dr. Fred Moss. I'll be back in a few more days with another podcast. Until then, be well and aloha.